Hello everybody, this is me Alquan. And I'm going to talk about a medical condition that is dangerous and sometimes can cause death, and that is a stroke. A stroke is a medical condition in which poor blood flow to a part of the brain cells that causes death. There are two main types of strokes: ischemic due to a lack of blood flow and hemorrhagic due to bleeding. Both causes parts of the brain to stop functioning properly. Signs and symptoms often appear soon after the stroke has occurred. If symptoms last than 24 hours, the stroke is a transient ischemic attack, also called a mini stroke. Hemorrhagic stroke may also be associated with a severe headache. The symptoms of a stroke can be permanent. Long-term complications may include pneumonia and a loss of bladder control. The most significant risk factor for stroke is high blood pressure. Other risk factors include high blood cholesterol, tobacco, smoking, obesity, diabetes, and so on. Hemorrhagic stroke is caused by either bleeding directly into the brain or into the space between the brain's membranes. Bleeding may occur due to a ruptured brain aneurysm. Diagnosis is typically based on a physical exam and supported by medical imaging such as CT scan or MRI scan. Low blood sugar may cause similar symptoms like a stroke. Prevention includes decreasing risk factors, surgery to open up the arteries to the brain in those with problematic carotid narrowing, and anticoagulant medication in people with atrial fibrillation. Aspirin or statins may be recommended for physicians for prevention. Stroke is a medical emergency. While hemorrhagic strokes sometimes benefit from surgery, treatment to attempt recovery of lost function is called stroke rehabilitation and ideally takes place in a stroke unit. However, these are not available in much of the world. In 2023, 15 million people worldwide had a stroke. In 2021, stroke was the third biggest cause of death, responsible for 10 total deaths. Between 1990 and 2010, the annual incidence of stroke decreased by approximately 10% in the developed world, but increased by 10% in the developing world. In 2015, stroke was the second most frequent cause of death after coronary artery disease, known as heart attack. About half of people who have had a stroke live less than 1 year. Overall, 2/3 of cases of stroke occurred in those over 65 years old. Stroke can be classified into two major categories: ischemic and hemorrhagic. About 87% of stroke is ischemic, with the rest being hemorrhagic. Bleeding can develop inside areas of ischemia, a condition known as hemorrhagic transformation. It is unknown how many cases of hemorrhagic stroke actually start as ischemic stroke. This definition was supposed to reflect the reversibility of tissue damage and was devised for the purpose, with the time frame of 24 hours being chosen abruptly. The 24-hour limit divides stroke from transient ischemic attack, which is a related syndrome of stroke symptoms that resolve completely within 24 hours. With the availability of treatments that can reduce stroke severity when given early, many now prefer alternative terminology such as brain attack and acute ischemic cerebrovascular syndrome. Stroke may be preceded by preliminary symptoms, which may indicate a stroke is imminent. These symptoms may include dizziness, speech disorder, exhaustion, weakness on one side of the body, tingling, prickling, chilling, burning, numbness of the skin, pathological laughter, seizure that turns into paralysis, and so on. Assessing onset, duration, and the presence of other associated symptoms are important, and preliminary symptoms may not appear at all or may vary depending on the type of stroke. Stroke symptoms typically start suddenly over seconds to minutes, and in most cases do not progress further. The symptoms depend on the area of the brain affected. The more extensive the area of the brain affected, the more functions that are likely to be lost. For example, in intracranial hemorrhage, the affected area may compress other structures. Most forms of stroke are not associated with a headache. apart from hemorrhage and cerebral venous thrombosis and occasionally cerebral hemorrhage. This is me, Alquan, and I hope you learned a lot about this stuff. And if you or someone you know who has a stroke, take them to the hospital. Or if you or someone you know who has a stroke, they should take Eliquis, because Eliquis reduces the risk of stroke, meaning that if you do not take Eliquis, you will be able to have a stroke again, once again. This is me, Alquan, and I'll see you next time. Remember, keep learning and you will know a lot. And once you have learned a lot, you'll be able to know a lot. Wow, we got 260 subscribers. I just want to say thank you for all the love that you have shown me. I want you to keep doing the work. Keep doing what God has called you to do. And I'm very proud of it. Hello everyone, this is me, Alquan. And if you like this video, I want you to like and subscribe.